Hello friends, welcome back to part 2. So in this I will be including more than 50 questions, so that will be around 100 plus questions I will be covering. So stay tuned. Okay, so adder head, cobra head appearance, image based question was given, and that answer is uretrocele, one liner and very much repeated question. Then Malampatti classification, image based question was given, that was grade 1, and that easy to intubate was the answer for that. Now, image-based question for thyroid ophthalmopathy was given, and one more question with TPO antibodies is seen in hypothyroidism. So this is two questions related to thyroid they have given. Now, dermoid cyst, image-based question, cyst at the corner of the eye was there, and that was dermoid cyst. One Arogya Mandir, Ayushman Bharat Arogya Mandir, image-based question was given. Now, which of the following features is not of OP poisoning, organophosphate poisoning? So, in organophosphate, everything increases except except it was asked not in OP poisoning. Bradycardia is decrease in the heart rate. So, if tachycardia was there, that was the correct answer. So, features are all the symptoms will be increasing. So, bradycardia was not the answer. That was the answer, that is not the feature. Now match marker of neuroendocrine tumor, that is chromogranin, that is the correct answer. Now child with rashes and coryza, measles and bluish discoloration in the buccal mucosa was there in the option. Bluish discoloration in oral cavity, buccal mucosa. So measles was the answer for that. Now image-based question for necklace appearance in USG, that is simpler and much repeated, with PCOS is the correct answer. And rice water diarrhea is due to cholera toxin. This is all very simple. Now Zenker's diverticulum, it is between what muscles? So cricopharyngeus and thyropharyngeus, this is the correct answer, and in between these two muscles Zenker's diverticulum is present. Now image based question in CT, it was given like convex shaped lesion, blood accumulation, it is EDH, this was given. Now omega shaped glot is seen in laryngomalacia, that is the correct answer. Decrease in milk production by use of which drug? So bromocriptine drug, if it is given, this causes decrease in milk production. Now boggy uterus, heavy bleeding post delivery, so what is the first line of management? So first line of management is artery embolism that and Lynch sutures to stop the heavy bleeding, this is the correct answer. Ring of fire appearance on Doppler, so corpus luteum cyst, this is the correct answer. On Doppler it is seen as ring of fire appearance. One image based question, history of testicular mass, with the images of the pathological slide with clear cytoplasm, lymphatic infiltration. So in testicular mass, so it is a male patient. So if it is a male patient, the answer will be seminoma, and if even a female patient, if they have mentioned ovarian mass, it should be dysgerminoma. Now image based questions, target cells slide was given. So target cells are mostly seen in thalassemia and not iron deficiency anemia. Now Burkitt's lymphoma translocation, what translocation is there? So translocation of 8 and 14 chromosome is seen in Burkitt's lymphoma. Now case of CML, 9/22 translocation, symptoms fatigue, weight loss and splenomegaly, leukocytes with marked differentiation, and bone marrow hypercellularity was given. So what is the management? Treatment is imatinib. Imatinib is the treatment for CML in these conditions. So patient with fever, fatigue and bleeding, 3 weeks duration and 60% of the blast are seen. So the duration is 3 weeks and 60% of blast, so it is seen in AML, acute myeloid leukemia. Now patient with bleeding tendencies and factor 8 is 50%, what will be the diagnosis? If the factor 8 is less than 50%, then answer will be hemophilia, but if it is 50%, the answer will be von Willebrand disease. Now, ISC marker positive in nerve sheath tumor. So nerve sheath tumors are schwannoma. So marker is S100. This is also a simple one. Now testicular tumors in which Shival dual bodies are seen associated with which tumor marker. So it is yolk sac tumor they are talking about. Yolk sac tumor, Shival dual bodies are seen. And tumor marker is alpha fetoprotein that will be seen. Now patient with transient genital lesion with painful inguinal bubo lymphadenopathy, which chlamydia is responsible. So chlamydia L1, L2, L3, it is most virulent and most common, and it will be seen in this case. Patient with fever 3 days followed by centripetal vascular rashes. What will be the diagnosis? So they have mentioned centripetal vascular rash. So diagnosis will be chickenpox. Borderline tuberculoid leprosy, MOT with acute inflammation, lesions and neuritis. What will be the treatment? What will be the management for this? They have asked. So continue MDT and start prednisolone. This will be the answer for this. Now painful genital ulcer with ragged edges and tender inguinal lymph nodes. So painful genital ulcer with lymph nodes and ragged edges. So this is the features of sarcoid, and sarcoid is caused by which organism? Haemophilus ducreyi. This is the correct answer. Patient with rheumatoid arthritis with rapid progressive painful ulcer with undermined borders. Image based, it was an image based question, and I missed one point. Patient was diabetic, type 2 diabetes mellitus. What will be the diagnosis? Diagnosis is pyoderma gangreosum. That is the correct answer. Okay. Now dashboard injury, most commonly seen is injury is posterior dislocation of the hip is the most common injury in the dashboard injury. That was the correct answer. Now 2 months old history of 2 months old history of fever and pain with sequestrum with discharging sinus. What are the characteristic features and what is the disease? So chronic osteomyelitis will be the correct answer for this. Now loss of sensations in all fingertips due to elbow fracture. So if they have mentioned all fingertips, that is because of median and ulnar nerve. So the sensory supply is of to all the fingers is by median the 3.5 and ulnar 1.5. Remaining sensations will be there by these two nerves. If all the sensations are lost, injury to these both of these nerves will be the answer. Now Ewing's sarcoma, image based questions. So in that onion peel appearance and in the diaphysis it will be there. So in a diaphysis onion peel appearance will be seen. This is for Ewing's sarcoma. That's the correct answer. Now spina ventosa. Spina ventosa is TB of the metacarpals. So TB hand. So in this spina ventosa, this is the correct answer. Now bluish discoloration of cervix in patient at 8 weeks. That is called Chadwick sign. Women with rectal bleeding every time during menses and no rectal bleeding, but sorry, it was no rectal bleeding was there, but women with rectal bleeding every time during menses because of endometriosis and not hemorrhoids. Now USG of a woman with pregnancy test positive, image based question, that was given a snowstorm appearance was given in the USG. So what is that? That is complete mole. Oxytocin augmented labor, in that bradycardia with contractions and fetal head is felt at 5/5. So what can be the diagnosis? Most commonly it can be placenta previa. That will be the correct answer. Now women with cardioid discharge pseudohyphae are present. So vaginal candidiasis is the correct answer. No doubt in it. Now IUCD with pain abdomen and bleeding in seen is uterus So what is the best management? So best management, if it is heavy bleeding, then we have to remove. If normal bleeding and pain abdomen is there in the initial parts, so we will not remove the IOCD. We will give NSAIDs and reassurance. That is the correct answer. Then 14-year-old girl with fully developed breast with scanty pubic hairs. So that is because of three things: Mullerian agenesis or Turner syndrome or feminization syndrome. That is the correct answer. Then twins and second baby is in transverse lie. So what will be the management? Management of these, it will be no external cephalic inversion, but IPV is the correct answer. IPV will be done, internal podalic version, that will be done for this case. Now 53-year-old diabetic and hypertensive with post-menopausal bleeding 8 months ago and hysterectomy, and growth was there in 8 mm in endometrium. So CA, this is a simple question. CA endometrium is the correct answer according to the age and what are the giving complaints. Now pap smear, atypical glandular tissue. Next step is endocervical biopsy, and after this, if they ask by and after endometrial biopsy is the next. Then complete mole at 13 weeks. What is the management? So dilatation and curettage will not be done. DNC will not be done because it can invade the mucosa, but suction and evacuation is the correct answer. That was done. Permanent method of female contraception. So tubectomy with modified polymerase method. This is the correct answer for permanent method of contraception. Now best contraceptive for patient with uncontrolled hypertension with P2L2, that is tubectomy. And OC pills will not, that will be the contraindication with uncontrolled hypertension. With child with complaints of bluish spot and buccal mucosa, measles. Then baby with persistent asymmetric tonic reflex will not be able to achieve which milestone? So persistent asymmetric tonic reflex at the 6 months of age. So rollover should be present, but it will not be achieved if asymmetric tonic reflex are present. Then ductus venosus bypass channel which passes the liver continue as ductus venosus will continue as inferior vena cava if after passing from liver. Now use of MDI, the spacer in asthma, that image was also given. So that will decrease oropharyngeal deposition and decrease speed of aerosol. That what it leads to? It leads to better deposition of the drug in the lungs. Now child with complaints of fever and rashes, decreased platelets, normal APTT, and peripheral smear that will show increased megakaryocytes. So what is the diagnosis? That is also repeated one. ITP, idiopathic thrombocytopenic purpura is the correct answer. Now newborn with LSCS with breathing difficulty and fluid in interlobar fissure. So transient tachypnea of the newborn is the correct answer for this. And worker in the rice field with conjunctival suffocation and icterus, what can be the disease? So it is mainly caused by Weil's disease. And patient with Burkitt's lymphoma, Paul Bunnell test confirmation of what organism is done, that is Epstein-Barr virus is done for Burkitt's lymphoma. That is also very much repeated. Now factor 10 and factor 5 in media is used to grow which organism? So it is used for Haemophilus influenzae. Fast moving serpiginous rashes, that is because of strongyloids. That was the correct answer. Now wool sorter presented with black scar on arm, which organism can cause? Bacillus anthracis can cause black scar on arm. Now Ansa cervicalis supplies all except, so thyrohyoid is not supplied. Otherwise sternohyoid, omohyoid and the other options that are supplied. So that is the correct answer. So I hope I have covered more than 150 plus questions, And if any questions you can recall, you can tell me in comment section. We will sort it out. Stay tuned.